Hi, my name is Mike Heenahan, and I'm the Fellowship Director of the Sports Medicine Program at O'Connor Hospital. And in this session, we're going to review some exercises for the shoulder. There's hundreds of exercises we could choose from. The ones we selected we're presenting because we think they're the most effective and the easiest to do. Any exercise program should be done in conjunction with a regular exercise effort on your part. And I'd suggest that you do a walking, swimming, or cycling program, or running if you like, along with these exercises. We're going to start first with a little description of what the exercises are intended to do. This is a model of the shoulder. This is the front and back. This is your wing bone or scapula, your arm, and your collarbone coming in. The key thing to understand about shoulder biomechanics is on the back of the shoulder, there are a couple of muscle groups. Obviously, the muscles are not on this model, but if they were here, there'd be a muscle here called the infraspinatus and a muscle up here called the supraspinatus. And these muscles come together and attach to your shoulder. And the purpose of these muscles is to raise the arm up. They also do what we call external rotation. And then very importantly, there's a third function in that they pull down on the humerus or the upper arm bone to allow more room underneath this bony tunnel here, because this muscle here, the supraspinatus, has to go underneath this bony archway. And that's where the problem often is when there's shoulder pain. That muscle gets pinched by the arm bone, the humerus, as it pushes up against this upper bone here called the acromion. So the exercises we're going to demonstrate to you are designed to help improve the functionality to make your shoulder work better. Now, you may have a little bit of discomfort with stretching and some of the strengthening exercises we're doing, but it shouldn't be persistent. And if you are having persistent pain, then you should check with your physician or therapist before continuing to do the exercise. We're going to start first with some strengthening exercises, but to stay consistent with the handout, we're going to start with the advanced ones first. I don't recommend that you start with these if you're having shoulder pain, but we'll demonstrate them now, and in a few minutes we'll demonstrate some simpler exercises that are more appropriate if you're having some acute discomfort. We're going to start first with an exercise called a dip, and with this one you want to stand up, and this could be done with a chair that has arms on it. In fact, that's probably a better way to do it than a table. Or you can do it as long as with a table, as long as there's not something that's going to slide away from you. So for this, you position your hands behind you, step a little bit away from the table, and then you're going to bring your body down, and you can adjust how far you go down to your comfort, and then you come back up. And this is easier if the legs are closer to the table, and it's harder if the legs are further away. So for most people, having the legs close to the table is going to be a better way to do the exercise. You do probably 5 to 6 repetitions, and with this exercise, that's probably enough unless you're in good condition to do this. Again, this is an advanced exercise, and it should be done as a latter part of the exercise program. The next exercise we're going to demonstrate is called a push-up with a plus. On this one, we want you to get in a position where you're going to do a push-up, and you can do this up on your toes, which is a more difficult type of push-up, or it can be done on your knees as well. And so if you're just getting in shape, or if your shoulder is a little sore, then you probably want to do the easier on the knee position. But for the moment, we'll demonstrate it up on the toes. And with this, you do a regular push-up coming down, and then you're going to bring it up, and then the plus part is where you bring your scapular or wing bone out to the side here and hump your back a little bit. That helps strengthen the muscles that are stabilizing the scapula. Back up and then down. We'll demonstrate that one more time. So the push-up and then the plus part. Okay, great. And again, this is a more advanced exercise. I don't recommend either the dip or the push-up with a plus unless your shoulder is starting to feel better and you're on the latter part of your strengthening program. The next set of strengthening exercises are actually easier than the dip and the push-up with a plus that we demonstrated before. So these are ones that you can do as part of a shoulder rehab program, either postoperatively or if you're recovering from a shoulder injury. I like to do this with what's called TheraBand, or you can use actually any sort of stretchy material. So this is a stretchy elastic band. It's nice because it's very portable. You can keep it in your office or put it in your suitcase if you're traveling, so very convenient. You can buy these at most sporting goods stores. So we're going to demonstrate a series of exercises that are designed to strengthen those muscles that we talked about when we reviewed the anatomy, the muscles on the back of the shoulder here, the supraspinatus and the infraspinatus. So we're going to start first with an exercise called rowing. And I'm going to demonstrate this by being the anchor here, but you could put the end of the TheraBand around a doorknob or any other immovable object to do the same thing. But for purposes of this demonstration, I'll be the anchor here. So what you want to do is add a comfortable amount of tension to the TheraBand, and then you're going to pull with a rowing motion back. So the elbows are held against the body, come straight back, nice slow motion, and you want to do maybe 10 repetitions, and then you're going to rest, and then you could do another set of 10 repetitions following that. We're also going to use the TheraBand for the rest of our exercises too. And so I'm going to give this to our patient here, and he's going to demonstrate external rotation. So by anchoring one side, and again, this could be anchored to a doorknob or other immovable object, and you just bring the arm out in what's called external rotation. And again, this is strengthening the muscles of the upper back here that we want to strengthen as part of our rehab program. And you want to do probably about 5 to 10 repetitions per set, and then you give your arm a break. You could do the other side, and then after a short break, you could come back and do another set if you want. It is possible to do too many of these exercises with too many repetitions and actually aggravate your shoulder. So you want to limit it to about 10 repetitions per set with a break between the sets. Now we're going to demonstrate another position. So you step on the stretchy TheraBand to anchor it, and then you're going to bring the arm up into what's called abduction. You're going to bring it up, and you don't want to go above 90 degrees. You want to keep this below 90 degrees as you do the exercise. Again, about 10 repetitions per set. Give it a break between sets, and then you can repeat that if you want. The next movement is called flexion, and now you're moving in the forward plane. Same rules apply. You want to keep the arm at about 90 degrees or lower as you come up. About 10 repetitions per set. And then the next one is extension. So now you just move the arm back, reposition the hand and come up. And again, in this position, you're probably going to be able to come back about 45 degrees, and that would be it. Again, no more than 10 repetitions per set. The previous set of exercises that we demonstrated using the stretchy band material could also be done with weights. The stretchy band is a little bit easier, so we demonstrated with that. But we're going to show another exercise here that we're calling a figure of 8 exercise that actually incorporates all of the things that you were doing with the dip, the push-up with the plus, and then all the different movements that we demonstrated with the stretchy band material. It incorporates them all into one movement, and we feel that this appears to be as effective as the other collection of exercises, but it's a lot easier to do because there's really only one movement pattern. We're going to demonstrate that now for you. So in this demonstration, we're going to use weights, and it's easier to use, to hold weights in both hands for this particular movement for balance purposes. You don't want a lot of weight, probably 5 to 10 pounds at most is sufficient. And for this movement pattern, we'll start first with the left arm, and you're going to bring the arm up, and again, you're going to make one circle of the 8 in front of you, and then you bring the arm back, and then one circle of the 8 behind you. And you just repeat that motion nice and slow, and with each pass of the movement, you want to cross the midline with the weight. So crosses the midline in front, and again, you just come up to about 90 degrees, bring the weight behind you, and bring it up in front. And you would repeat that about 10 times. Again, a nice slow movement. And after you've done a 10 repetition set, you could stop, and then you could go ahead and do that on the other arm if you chose to do that while you're resting the other side. Next, we're going to demonstrate some stretching exercises for the shoulder. First one's called an anterior stretch. To do this, you bring the arm up, and I'm going to demonstrate as if I'm helping him stretch, but this could also be done against a door frame ideally too. So if my arm were the door frame, you would position your arm against the door frame, and then you just bring your body forward, and this stretches the front of the shoulder here. So this is called an anterior stretch. And then you relax a little bit, and then you bring it down again, and again lean forward to put a little stretch in the anterior portion of the shoulder. The next stretch is called a posterior stretch. For this, you bring your arm across your chest and bring your other arm over, and you're going to add a gentle pull. And with this exercise, you're stretching the back part of the shoulder, or what's called the posterior part of the shoulder. And these together provide a good functional stretch to the shoulder. Okay, you can bring your arm down. And again, you would want to repeat those probably 2 or 3 times, holding them for maybe 10 to 15 seconds with each stretch.